So now on to module 3, and this is where we're going to talk about the mother's state during pregnancy, and then the perinatal environment, which basically means the events surrounding the birth. And so, talking about the mother's state, first we want to look at influences on overall development. And of course, the age of the mother is going to dictate some of this and the development. Typically, there is kind of a golden period of when women optimally can get pregnant. And that starts roughly around 18 to 19 years old and goes up to about age 35. If you're younger than 18 and get pregnant, that's considered a higher risk, mainly because the mother's body isn't fully formed yet. And while biologically kind of capable at a rudimentary level of carrying a baby, there are a host of risks because the mother's body is still developing. You get past 35, the mother's body is no longer as fit as it was during that 18 to 35 range, and you have a lot older mechanisms in place, and so you have a higher risk factor there. So that's kind of the ideal, is to kind of get pregnant and have children between the ages of 18 to 35. Not that you can't a little bit later, but you do introduce more risk. So as far as emotional condition, you do want to have a supportive environment. Occasionally you will have these horror stories of girls at the age of 14, 15 years old who get pregnant, hide the pregnancy, and have it, and discard it or abandon it later on, and probably a high stress environment trying to control and cover that they are pregnant. Or that they get kicked out of their home when their family finds out they're pregnant, or they're under an abusive situation. There's a whole host of things that can influence it. And so it's not necessarily stress, momentary stress. We all have that, but it is more a constant pressure of stress over time that can really have a bad effect on the overall development. Nutritional condition, nutrition, healthy, high protein, high calorie diet is recommended. It's probably one of the few times in adult life when women or men could really indulge, of course, with women indulging during pregnancy in a lot of their high calorie, but we want to also keep it healthy. The typical weight gain for a woman is 25 to 35 pounds during their pregnancy. And then if they don't gain that much, you can have the issue of stunted prenatal growth, because a fetus requires a lot of energy to be able to grow to the size that it becomes. So things like malnutrition not only stunt the growth, but they can cause cognitive deficits too down the road. Okay? And that gets into this maternal malnutrition issue and stress. So next slide, it can just illustrate the influence of age. And you can see the fetal death rate per 1,000 live births. Under 15, you can see it's very high, and over 45. But if you can see that sweet spot, really like 19 or 20 years old to about 34 years old, you have the lowest amounts of fetal mortality. And so, like I said, that's kind of your ideal time. And then you see, as soon as it goes into the 35 to 39 range, you begin to see the risk start shaping up again. So it's a really kind of a U-shaped curve overall. Now, the perinatal environment, as I was mentioning earlier, is the environment surrounding the actual birth. And so what you have is a variety of possible hazards, because things can happen, unfortunately, during the birth. You can have issues where the child is what we call a breech birth. This is where you have their legs coming out through the birth canal first. That's a very jagged way to be coming out. Very easy for a shoulder or one leg to make it through and not another one. And then it gets stuck, which puts the mother and the child's lives at risk. And so typically, if they have a breech birth, they suspect it, they will go with a cesarean section, which you can see in the photo on the left there. That's called a C-section or cesarean. And that can help mitigate any issues regarding a breech birth. Now, that child right there is the traditional head first, and that's usually a vaginal delivery is what you would prefer, because cesareans are surgeries and do have some form of risk associated with them. Another hazard that we can have is something called anoxia, sometimes referred to as blue babies. Blue babies because they have not been getting oxygen for a period of time. And of course, the effects of that dependent on how long that oxygen's been deprived. This is where you might see things like cerebral palsy or intellectual disabilities that result from that oxygen shortage. A lot of times it can occur because the umbilical cord, you have babies in utero who like to really be gymnasts and kind of jumble themselves around, and they put knots into the umbilical cord, but they're not tight. And so there's no problem until the birth comes and you tighten the umbilical cord and then you cut off the oxygen supply. And once again, depending on how long that is. Now, my youngest evidently was quite the gymnast because she had not one, but 3 knots in her umbilical cord. Fortunately, none of them got lengthened and tightened enough to have a bad influence on hers. But you can see there was a danger there. Now, if you do have anoxia, they can put you under an oxygen tent, and that usually clears things up for a lot of babies. Just once again, depends on how long. Now, unfortunately, if it's for a long period of time, and it's any lack of oxygen, not just the umbilical cord getting knotted. Sometimes you can have the issue of stillbirth, which of course is quite traumatic, especially if you know there was a fetal heartbeat all the way up towards until the end of the pregnancy and the child's delivered. Okay. You have your issues of complicated deliveries. So once again, sometimes babies can get stuck in the birth canal, even if they're going head first. And if that happens, then they have to rely on something either called forceps, which I know there's a much more technical term, but kind of imagine, salad tongs going in and forceps, and you put it on either side of the baby's head and pull the baby out. A lot of stress on the baby's head, neck. But of course, they can't stay in the birth canal and would die if they stayed there. So there's not a lot of alternatives. Another one is a vacuum delivery where they basically put a vacuum suction on the top of the baby's crowning head and once again pull out. Now, of course, most of us the physicians try to avoid that whole situation, and that's where you may see the cesarean that I was talking about earlier. Medication, there are a couple of different types of medications that women can take while they're during delivery. One is more of a general anesthesia. They don't tend to use that very often. They usually use more specific one, and that is where they go ahead and inject into the woman's spinal cord, and it just numbs her from the waist down, and therefore can go ahead and have the baby without all of the associated birth pains, labor pains from delivery. And so generally they don't really see complications if you happen to have medication used during pregnancy, especially for the delivery, but there is that risk. So it's not totally risk-free. Okay. Now, once the baby has been born, the mother can experience some issues. One of the most common is baby blues. It's actually more common to have baby blues than not. So baby blues occurs in about 60% of all mothers, and they report these symptoms of being tearful, irritable, moody, anxious, and depressed. And these all are usually within about the first 10 days after the baby being born. And a lot of that is due to the woman's body converting back to a normal state from being in a pregnancy or reproduction mode. There are a lot of hormones and other things in the body that need to change back to normal, and that occurs fairly quickly, but there is a transition time. So it is perfectly normal for women to not feel this glow of having had a baby initially right after birth and have these kind of feelings. But it usually resolved for most women. Now, so for the women that it doesn't, though, we have the issue of postpartum depression. These are much more significant and would qualify as an episode of clinical depression. And it can last for a matter of months compared to days for the women that have been born. Occurs in about 15% of all new mothers. And a lot of times these new mothers have had significant emotional issues in the past. So there may be a precursor even before they were pregnant. The dangers here of a woman who's depressed is that they don't respond to the baby's cries, so the baby's health is somewhat at risk. If you can't get the energy to get yourself out of bed because you're so depressed, you're obviously not going to be caring for the baby. And so that can have some real issues with attachment too, in regards to social relationships. So, as part of a screening, if you go into a pediatrician's office, they will often do a screening for depression in new mothers to make sure that they get the support they need and any medication or other services to kind of help that. So, all right, we are on to the last module. Module 4 is next. We're going to talk about neonatal environments and at-risk newborns. So go ahead and stay tuned.